Hi, my name is Ben Gloff, and I'm a physical therapist here at the Children's Health Andrews Institute. Today, I'll be talking about how we assess running. And so today's PowerPoint is titled Introduction to Running Analysis. So objectives for today is, why is running analysis important? Can we standardize a run gait? What are some common running faults that we see while we're assessing these patients, these athletes? And then how do we perform a running analysis? Running has a very high injury prevalence. For adults running, they have the highest incidence of injury versus other sports. Okay, and that range is anywhere from 10.9% to 74.9%. So it's a pretty high range. It's all over the place. A lot of runners, recreational runners and professional runners report injury or pain very commonly. So 1 in 5 recreational runners report musculoskeletal pain. 75% of elite runners at some point are reporting musculoskeletal pain. And then elite marathon runners have 4 times the injury risk compared to their peers. As we increase our volume, our chance of injury dramatically increases as well. So that can be 6 times a week, and anything greater than 30 miles during the week, your chance of injury goes up exponentially. 50% of runners experience some sort of injury throughout the whole year, and 25% of runners are injured at any given time throughout the entire year. So why are they so common? Why are injuries so common with running? There's a pretty high exposure rate. There's more than 50 million Americans that ran in 2022. And so that's 15% of the population of the US. And that's reported, right? So there's other people that definitely could have been deciding that they wanted to go run to make it a part of their daily life, especially during the pandemic when gyms were closed. A lot more people were running, myself included. Running is a skill. It takes practice, it takes effort, it takes breaking down your mechanics, just like you would in any other sport, right? So it's no different than if you're taking a baseball player that's trying to learn how to swing the bat correctly or throw the ball correctly, or a volleyball player that's trying to learn how to hit the ball better over the net. It's a skill. It's not just something you can go out and do and just automatically be successful at it. So we have to keep that in mind when we're assessing these patients, these athletes, when we're trying to give them direction on running and what they should be doing going forward. We also have to remember too that with running, your vertical reaction forces increase 2 to 3 times body weight. So that's a lot of impact forces through the body, through the joints. So as we increase those forces, our chances of injury go up too, especially if we don't have good form. So this is just a chart that looks at load capacity. So you start your day, each day you're going to start with a certain load capacity, right? And depending on extrinsic factors, intrinsic factors, that's going to determine your load capacity for that day. So say you go out, I'm getting ready to go for a run in the morning. I really have to think about, how well did I sleep last night? When was the last time I ran? If I have any previous injuries, did I eat or hydrate well yesterday, the day before, a couple of days? So you really have to think about everything that has happened prior to the run to determine, okay, my run is going to be a little bit longer today. I'm going to have a long run. I may have to do a shorter run. So really be assessing and encouraging your patients and clients to assess how they're feeling in that day when they're getting ready to go for a run. So, and this chart just shows as your load capacity goes down, your chance of injury goes up. So these are just some common running injuries that we see with runners. Start from low back, works down to your hamstrings, your glutes, IT band, Achilles, your calf muscles. A lot of people report patellofemoral pain syndrome. Shin splints are very common. and then plantar fasciitis. So the whole chain can be affected from low back down when we're talking about a running athlete. So study done in 2021 was a systematic review of running related musculoskeletal injuries in runners. And 70 to 80% of those were due to overuse. Most common injuries were knee and ankle, but that differs among the types of runners. So ultramarathon runners versus non-ultras. You had a higher incidence and prevalence for patellofemoral pain syndrome and medial tibial stress syndrome in non-marathon runners versus marathon runners. So with the marathon runners, you had a higher incidence of your ankle injuries, your Achilles tendinopathies, your anterior compartment tendinopathies. So much more common to see in the ankle, the Achilles, in your ultramarathoners, seeing those injuries versus knee pain and shin splints in your non-marathon runners. Males are actually more likely to report ankle injuries, and knee injuries are higher in females. And a lot of that has to do with the Q angle, your biomechanics of male versus female. And then females also typically show a decreased knee flexion angle with landing. So that's also something very common when we talk about other sports with incidences of ACLs. So intrinsic factors, anatomy plays a huge part. You know, we've talked about it in earlier slides with greater Q angles. We're going to have changes in your biomechanics. And where we can kind of help with that is we really need to be assessing strength. We need to be assessing hip strength. We need to be assessing mobility. How can we help with that? So with each patient that comes in, we need to be delving into each aspect of what could be affecting their run, their ability to run. So we can definitely help with that in some ways. Foot structure is something we need to look at as well, whether they have, you know, pes planus, plus pes cavus, a neutral foot. So assessing that is part of what we should be doing. And that in turn can help with looking at other things like shoes, what kind of exercises we can prescribe to help strengthen up any muscles, any deficits that we see. Gender plays a role in it. Males are at a higher risk for higher BMI. Females have a higher risk for navicular drop. So there we go, talking about the foot structure. And then stress fractures are higher in females, like the incidence is higher in females. And so we have to really delve into and consider whether or not we're dealing with an athlete that potentially has female athlete triad going on. So always be asking, always be assessing, figuring out how can we make sure that we're attacking all angles to help this runner, to help this athlete be able to achieve the level of success that they're looking for. And then of course, age, right? As we get older, we start to see changes in collagen, changes in bone. So people who are later in life that decide they need to get into running or they want to get into running, sometimes we see a higher incidence of injury because of the structural changes that have taken place biomechanically. Extrinsic factors, we look at training, right? The volume, the amount of running they're doing, the type of running they're doing, right? The intensity. So is it a long, slow duration run? Is it a high intensity interval training type running? Is it sprints? You know, what are we looking at? So making sure that we're assessing their training, and a lot of that we don't have control over, right? So if we have an athlete that comes in and they're injured during season or before season or after season, the training that's taking place with coaches, you know, we need to have those discussions with these athletes. And then in turn, at times, if we're able to, have those discussions with those coaches too. Have an open line of communication with those coaches, with the athletic trainers at the school about this athlete that you're seeing. and their training volumes and what you can change, right? We don't want to completely shut them down unless we absolutely have to. And that's where communication is key. Stretching is important. So if you got a runner that just goes out cold turkey and just starts running, their injury incidence goes up as well. So we really want to make sure we're making sure that the athletes know the importance of stretching before and after. Sleep, just like in any other sport, if we are not getting enough sleep, if we are not getting adequate sleep, our risk for injury goes up, right? If we studies show that if we aren't getting, if we're getting less than 8 hours of sleep, you have a 1.7 times higher risk for injury compared to those who are getting 8 or more. So making sure that our athletes know that sleep is important is a part of our job. Okay, we need to make sure that they know that sleep and the amount of sleep and good sleep, and maybe even ways to improve sleep, is a great way for us to help those athletes improve their ability to perform. Shoe type is also something that we try to look at. I'll go through that in a later slide, but making sure that these athletes have a correct shoe for their build, make sure it's comfortable for them and they're not just trying to force themselves to wear a shoe that isn't good for them. So shoe type is important. So there's really 4 main types of running shoes. Okay, we've got a neutral design for a neutral foot. We got a stability type of shoe, which is designed to help limit overpronation and support that flat foot, that pes planus foot. The cushion shoe is to help increase the cushioning to support supination, or a foot that has higher arches, pes cavus. And then we saw it start to come about over the last decade or so, the minimalist shoe or the barefoot running, where there's little to no cushion. And we're just kind of running with that barefoot feel, whether or not it's truly barefoot or the shoes that have the toes, or just a zero drop shoe, right? And when I say zero drop, I'm talking about the drop from the heel to toe. So typically the range is somewhere between 0 to 12 millimeters. And that is the amount of drop from the heel to the toe. 0 to 4 is considered minimalist. So when you hear somebody say, I've got a zero drop shoe, that just means there is no change in height from the heel to the ground, to the toe to the ground. So zero drop shoes are very common, very popular right now. Even if it's not barefoot or not the toe shoes, they've become much more popular. So why does this matter? A higher heel drop is going to promote heel strike. Not necessarily saying that's a bad thing, but as we increase heel strike, we see a change in running form. So with a higher soled shoe, we're going to be more likely to heel strike. We're going to change that running form. And that in turn, one of the dangers or issues with that is going to increase anterior knee stress. So then you're going to see your patellofemoral pain syndrome, even down into shin splints. So assessing that and making sure that's not going on is important. And we'll talk about that in a couple of slides. A lower heel drop is going to promote that midfoot strike. So as we see that midfoot strike, we're going to see an increased cadence. Not saying that is the gold standard and that's what we need to be doing, but there is some benefit with some studies that show that midfoot striking versus, or forefoot striking versus heel striking, you have a decreased risk of injury. So, and we'll delve into that here. So Moody in 2018 looked at a comparison of heel to toe differences in cushion to the barefoot running, right, in novice to minimalist runners. They did not see a difference between the 12 millimeter and varying heel to drop, ranges. And then the only difference they saw was there was a difference between contact time, stride length, and vertical oscillation. So, that study looked at that, didn't really see a ton of differences, but those three things. And then a study in 2017 looked at adaptation of running patterns to the drop of standard cushion shoes, and then had a 6-month follow-up following that. They compared 10 millimeter, 6 millimeter, and 0 millimeter over 6 months or 500 kilometers, and they saw no change in running pattern from initial testing. The only thing they saw that was of some sort of value is you had increased knee abduction at mid stance with the minimalist shoe. Sun et al. In 2020 did a systematic review of the role of footwear with running biomechanics. They looked at the effects of shoelace, midsole, heel flare, your heel to toe drop, and then compared minimalist shoes as well. What they found was increasing stiffness of the running shoes at an optimal range. So they were looking at potentially forefoot increased stiffness can benefit performance variables. So they did see that. Softer midsoles can reduce impact forces and loading rates. So that in turn can be something that's beneficial. Increasing those impact forces lessens the force up the joint, up the rest of the body. So in turn, potentially decreasing our chance for injury. Thicker midsoles, they offered better cushioning and helped with shock absorption, but you did see a decrease in plantar sensation. So there's kind of a little bit of a trade-off there. You definitely want to be able to feel where you are in space, right? We talk about proprioception. And if we begin to kind of decrease our ability to feel where we are in space when we're running, is the increase, the improvement in shock absorption really that beneficial if we're compromising proprioception? That's a debate. Minimalist shoes can improve running economy and increase your cross-sectional area and the stiffness of the Achilles, but we do see an increased loading of the MTP in the ankle joint. So the other things they looked at, they didn't really find any differences with shoelaces or heel flare or heel toe drop. So a little bit of a mixed bag on that. And so all these studies so far have kind of been mixed reviews on what the best way to run is. So we think we know, we changed the shoes, we've increased the height, we've decreased the height, we've increased the cushion. So a lot of these studies are showing the jury's still out on what exactly the best way to run is. Study done in 2014 looked at injury reduction effectiveness when prescribing running shoes in the military based off of foot arch height. So they would imprint the foot to try to determine arch height. And they found no difference between the control stability shoe for all versus the experimental shoe, which was a shoe based on arch type. So didn't really see a difference between the two groups when they assessed the military. In 2015, they looked at running shoes. A study looked at running shoes and running injuries, looking at a preferred movement path versus a comfort filler. And in their study, they found that athletes will self-select a shoe that is comfortable for their natural movement path. So I think that's one of the best things that you can take from most of these slides when it comes to trying to figure out what kind of shoe you're going to suggest for the athlete. I say this personally when I'm talking to an athlete when they're asking for recommendations. We'll discuss things like if they have a flat foot or high arches. Depending on that, certain shoes may be more beneficial for them, and it may feel better to them, but it's more about the comfort. And at the end of the day, the athletes, the runners are going to select a shoe that is more comfortable for them. And getting into a shoe saying, oh, I think you'd run better in a certain type of shoe, whatever it is. If we say, hey, I think it'd be better for you to run in this shoe, and the athlete goes and runs in it and they have pain and it does not feel good, they're either going to continue to run through it and probably end up hurting themselves, or they're going to move on from the shoe and either stop running because they just can't get into running because it hurts all the time for them to run, or they're going to self-select another shoe. So I really try to stay out of the business of telling athletes what shoes to wear. And I'm very much in the camp of you need to find a shoe that feels good to you when you run. So going to these run places and maybe trying on shoes. And if you're suggested a shoe and it doesn't feel good, don't wear it. If you like the shoe and it feels good to run in it, use that one. Okay. And at the end of the day, if you get out into the field and you start running, and you don't feel good with it and you're not seeing any sort of improvement in your ability to run and it hurts and you're just not enjoying it, maybe that wasn't the shoe for you and it's time to find a new one. That can get expensive, but at the end of the day, we're trying to prevent injury. Another study in 2009, subjects rated comfort of shoe as a reason for them to want to run. So improved comfort in the shoe helped increase their likelihood of running. So let's shift gears here and talk about, can we standardize run gait? There are some camps that think we can, one including Dr. Romanoff, who invented the pose method. And he believes there is a universal running form, okay, that we can all benefit from being able to standardize running. And there's a way that we can do that. And so he very much believes that running is a skill and you have to work on your techniques, to work on your skill, to practice these skills to improve your running form. And he breaks running form down into running in general, down into 3 elements. What's called a running pose, which at some point we all go through when we're running, okay? The fall portion of running and the pull portion of running. So he breaks it down into those 3, takes those 3, and you assess running and issues with running and form that needs to be worked on in each portion of those sections. So he'll break it down and talk about how we all go through this same position, this running pose. This is a very typical look to runners, right? We all have this one point where we are in single leg stance on one side and we are swinging the other leg through, okay? To bring the other leg through to initiate initial contact to then start swing with the other leg, okay? So running pose is the moment when full body weight combined with increased load created by the speed of running meets the ground. So that's just a fancy way of we are going through the main part of our running form, through our running progression. We have to have stability and alignment in this position to maximize our potential ability to run, okay? So there's a lot we can assess from this position here. So if we decide I want to use this type of assessment, this is a great way to have just somebody stand in this position and then assess them here and then do the other leg, okay? And there's some things you can learn from just looking at somebody stand on one leg. We do it fairly often in other aspects of assessment as athletic trainers and physical therapists and doctors. Where we look at a patient just in the ability to stand on one leg. And if they can't do it, there's a lot of things that we can delve into to try to determine what's going on. So in his thought, proper pose is you could draw a straight line from the top of the head all the way down to the mid part of the foot. And you are preparing yourself for what he calls the fall phase, okay? So to be able to go forward, to be able to start walking, to be able to start jogging, to be able to start sprinting, whatever it is, our forward propulsion, the first thing we have to do is shift our body weight forward, okay? Whether you want to use this type of assessment or not, our ability to move forward has to start with us shifting our body weight forward. So at some point we are falling forward, utilizing gravity to move forward. Okay. He believes that natural running is free falling, and we utilize that power of gravity to drive that movement forward. And if we're trying to do it any other way, we're fighting gravity, and that's just wasted energy. Okay. We're wasting our energy, in his opinion, by trying to really focus on propelling ourselves forward versus utilizing gravity and that ability to fall to go forward. So during fall, our center of mass is moving past the support foot, and our support foot is our axis of rotation going forward. So we are, at this point, we have gone through mid stance. We are beginning to fall forward. We're preparing for terminal stance to swing phase on the other leg, on the stance leg. And getting ready to begin initial contact on the swing leg. So going through that and going through this stage, and our level of fall depends on, our angle of fall depends on what we're trying to achieve. Walking, of course, is going to be the least amount of angle of fall forward. Jogging is going to be more. Sprinting is going to be more. Now, there is too much. There can be too much angle of fall, and that you see that in runners who try to bend over or bend forward too much, or they have too much trunk length. So definitely want to find that sweet spot depending on what you're trying to accomplish, what type of movement you're trying to accomplish. And then the third part of it is the pull phase. And so instead of, he believes that when we're getting ready to, when we're starting initial contact with the other leg, the only way that we're going to start that is by pulling the other leg off the ground. So it happens before your lead leg hits the ground, before initial contact. So he looks at two mechanisms that help break that contact with the ground to start this pull phase, right? You've got the elastic recoil in your swing leg, and then your body, your center of mass falling forward, and the pressure coming off of your rear leg, your back foot, your trail leg. When that body weight shifts off of it, you've got to be able to come off the ground and start that next cycle. So his belief is you are pulling the leg off the ground, not pushing. Because once you get into that terminal stance, how much power do you truly have to be able to push yourself forward with that gastrocsoleus complex? So his thought is you don't really have that much. So pulling your leg off the ground is way more biomechanically sound, in his opinion, than using, trying to push yourself forward with that gastroc complex. So here's just a full length look at running, okay? So you see that first stage, that's your initial contact. You know, the second pose there is your running pose, right? Good position there, getting ready to begin the fall portion of your running. You know, the third picture there is your heel begins to lift in that trail leg as you're falling forward, as your angle of fall and your center of mass is going forward. That weight is coming off the leg to help begin 4 and 5, phases 4 and 5 here, where you're pulling the leg off the ground and you begin that flight phase before you start initial contact with the other side. So, common running faults that we see. The most common ones that we see, of course, you're going to have some that are off the wall and out there, and those are the ones you're going to have to, you know, work a little harder at to try to figure out, hey, what's causing this? What's the problem? So sometimes one of these running faults can cause problems elsewhere. So that's where we as clinicians have to decide what's causing the issue. Why are we seeing injury? Why are we seeing other run faults. So, if we got 4 things going on, potentially if we fix one of them, that may help with the other 3. So as clinicians, we need to be continually assessing each portion that we see that, hey, do they have pelvic drop? Do they have, are they overstriding? What is their cadence? Is their slow cadence causing the rest of these issues? So be mindful of that when you start assessing these patients. So pelvic drop's the first one. It's very common. Most of your injured runners are going to demonstrate a greater contralateral pelvic drop and a forward trunk lean at mid stance. So pelvic drop, contralateral pelvic drop was found to be the most important variable in predicting a injured versus a healthy runner. Okay. So what's causing that? It's a good chance there's a muscular imbalance. We're seeing a little bit of that glute med, posterior chain, abduction strength that's causing this issue. Okay. So if we're seeing this in this mid stance, we're going to see this in the mid stance. Okay. When you are assessing a runner and they're running away from you, that's going to be the best way to see, do they have this pelvic drop? And you're most of the time, if it's dramatic, it is going to be very easily seen. As soon as they start running away from you, if you're filming them and you're recording them, a lot of times, if it's dramatic, you're still going to be able to see it without even going to the video and looking at it first. So this could be a huge part of why we're having issues as a runner: injuries, pain, inability to increase distance without fatiguing, because there's a lot of energy being lost here because of strength deficits. So assessing running pose can help you in the situation and their ability to just stand on one leg. If they can't even stand in runner's pose, if they can't even stand on one leg, there's a good chance that there's some weakness up the chain that we need to address. So with pelvic drop, we're also going to see an extended knee, a more extended knee than we should, and a dorsiflexed ankle at initial contact. So can this lead to overstriding? Can this lead to us potentially having some stuff downwards too? Are we going to potentially have some patellofemoral pain syndrome or shin splints because of this? So really look into this first, test, and you'll know if you've done part of your assessment before the running assessment, if you've assessed strength, flexibility, range of motion, if you've gone through your evaluation of this patient, there's a good chance if you have felt that they have hip abductor strength deficits or even, glute max strength deficits, you're going to see this. It's going to be a big predictor of this potentially happening. So there's just some examples there. We want to see that neutral hip, not that contralateral hip drop, because of that weakness. So a lot of things go on down the chain if we're seeing this occur. Overpronation is just excessive calcaneal inversion, talar adduction, and plantar flexion. So if we're seeing this is very, very clear too. You'll see that foot roll over the shoe. You might see some wear on the inside of the shoe if you're looking at the patient's shoe, especially around that arch. So if we're seeing this, then we have to decide, are we seeing a true navicular drop versus a dynamic navicular drop? And then we have to look and see which way we're going to assess and what we're going to be doing going forward, depending on which of the two we see. So we're seeing this in the support phase, right? In stance, in pose, going through that runner's pose. And you're just going to see that loss of your longitudinal arch. Okay. This type of common running fault we see and flat foot is linked to higher incidence of tibial stress fractures, patellofemoral pain syndrome, and Achilles tendinopathy. So if we can potentially suggest the ability to work on strength, okay, working on the arch strength of the foot, There's certain things we're not going to be able to change, right? If it's a true navicular drop versus just a dynamic one, we're not going to be able to change that. So change what we can, affect what we can. The other thing we can do is, in this case, maybe we do offer a shoe that is that has that arch support. Okay, they may find benefit from that. So really assess that and look into that and try to figure out what the best way to address this is. And there's just an example. You see that they're rolling in on that medial part of the ankle foot. You're seeing that caving in of the arch. So very clearly you can see this treadmill or out on a field or track. Heel whip, all it is just a medial or lateral rotation of the foot in the transverse plane during initial swing. So the way you're going to see this, you might be able to see this from the side or from the front, but the best way to see if this is going on is assessing the patient running away from you. Women are much more likely to demonstrate a greater than 8.9 degree whip. More than half of recreational runners have a medial or lateral heel whip of greater than 5 degrees, but very little is known on why this occurs. Okay, we don't really know the significance of it or why it's happening, but most of the time, I'll tell you, when I'm assessing these patients, a lot of times I'm trying to figure out how I can improve that. Okay, because they're having to really, if you think about it, if they're whipping, if they're externally or internally rotating that tibia, they're having to adjust as they come through the swing phase. When from terminal stance into swing phase, going into initial contact, they're having to adjust their foot, and it could just be potentially wasted energy. So if we're seeing this fault, even though we're not sure what the significance of it is, a lot of times working on it can help decrease their potential likelihood of injury and help with better form. So at the end of the day, if we're helping them get better form, even though there's not much published on it, I think we'd be doing a disservice to not do so. So it's pretty clear, you've seen these types of runners, you may be this type of runner. So one of my favorite cues I like to give is it's been successful for me so far, not just for this, but for other ways of fixing contact and the swing phase and pulling the leg through, is I try to tell people, imagine every time you are trying to pull the leg through to get ready to go forward. The only way you're going to be able to do that if there is this glass window in front of you on each step. Your knee, shin, top of the foot have to hit it, okay? And that seems to fix a lot of that. So glass, only way to go through that glass to be able to land and put your foot down on the ground is by knee, shin, top of foot, all coming through at the same time. If you have that medial lateral whip, that's not going to work, right? So a lot of times that helps fix that. I found great success with that. So finding ways to improve their form through external cues and internal cues are a huge part of getting that buy-in. Overstriding. Overstriding is you have that increased stride length where your foot lands out in front of the center of mass. So you're going to see that increased reaching with the hip flexion, increased knee extension before initial contact, and you have that increased braking moment with forces at foot strike. So we see this all the time. A lot of times it's being coached, and if it's being coached by coaches to reach out and gain more ground over time, most of the time we're seeing these patients overstride. We're not seeing them improve their ability to run further, faster. Most of them are starting to get hurt because they're really trying to reach that leg out, and they're getting their leg way out in front of themselves, contacting the ground way out in front of themselves, and they're having to pull themselves forward through that front foot activating way more of posterior chain, hamstring than they need to be, really challenging those hamstrings. And this is a lot of times when we see those hamstring strains too. So really be looking for this. The best way to see this is from a side view. And the best way to improve this is by trying to increase cadence. So Boyer and Derrick in 2017 found that shortening stride length by 10% decreased nearly all lower extremity contact forces. So we really need to work on decreasing that stride length. And by doing that, a lot of times, all you have to do is just try to get them to increase their cadence, increase their foot speed contact. And we see this improve. So there's just a chart that looks at different types of striking, whether heel, midfoot, forefoot, and the effect on the foot and the rest of the body. So heel striking, you're going to see the joints absorb more impact. The foot is going to hit the ground twice. So you're going to have heel and then forefoot, midfoot separately. Midfoot, you're going to have an excess strain on the knee compared to the others. You're going to have an increased braking effect, and you're going to have that flat foot landing. So it's hard to replicate that. Okay. And then forefoot, you're going to have less joint strain on the rest of the body. But according to the studies we saw earlier, you are going to see that increased pressure and increased forces on the MTP joints and your Achilles a little bit as well. So the other thing too you see at the top of this is your support time decreases based on your foot strike. So the longest is going to be heel striking. So you're going to have to spend more time on the ground with that foot, which in turn is going to slow down the cadence, which then decreases your speed. Okay. So looking at these things, a lot of times, I've talked about other ways to improve running form. Cadence, a lot of times, can improve a few things. Okay. So overstriding being one of them. Work on cadence, work on that foot speed. That foot speed increases, their foot striking changes, and their ability to run faster further changes. So talked about this a little bit earlier. Having not enough or having too much trunk lean can affect your ability to run effectively. So your ideal trunk lean is going to be somewhere between 5 and 10 degrees. If you lean further forward past that, you're going to have that hunched over runner. That's not an effective way to run, and vice versa. If you have not enough trunk lean, you're going to have that very upright runner. And most of the time, they're going to be the ones that are going to be overstriding. So lower leg injuries are going to happen. And low back pain a lot of times can be increased in incidence with these upright runners. So see it a lot with people who are very upright. They start having that low back just fatigue because they're sitting back on their low back and just in that chronic extension and spending a ton of time there. So not good for the back. So you have to find that ideal trunk lean. Ways to work on this, I typically like to use having a band around the waist and just holding it behind them and having them start with just marches in place. Okay. So they're leaning into that band. They're working on that trunk lean without going anywhere in the moment. And then going from marches to stepping in place. And then going from marches to stepping to forward motion. So marching or stepping forward. Okay. And then from that point, I like to one of my favorite drills to help with this trunk lean is to get in front of the patient. Okay. If you have the ability to do so, get them out on the turf, get them out on the track, put your hands on their shoulders, have them lean into you and have them start their stepping, have them start their, high knee stepping, their marching in place, leaning into you, then have them start to progress to going forward. And then as they start to get into that ability to be in that position, it looks like they're running in place, letting them go and going forward. And then that trunk lean is improved dramatically. So working on that drill, getting them comfortable and confident and being in a more forward lean, then staying upright. Those drills typically help me improve that. Cadence, we've talked about it, right? Cadence, most of the time with running, with jogging, somewhere between 160 to 180 steps per minute. And I guarantee you, if you assess your patient and you take them out onto the field and you have them start doing stepping, if you have them start doing their running, have them run around, set a metronome to it, a lot of them are less than 160 steps per minute. And if that's the case, most of the time you're going to see that overstriding, you're going to see that increased stress up the knee, up the ankle, into the hips as well. So really looking at cadence can help, like I stated earlier, can help improve a lot of other issues that we see. So reduced cadence increases center of vertical displacement. So we do see a lot of vertical displacement with people who have that lower cadence because they're trying to propel themselves forward. They're trying to overstride. They're doing the things that we don't want them to do, and that increases their risk for injury. So look for that reduced cadence. Try to work on speeding them up. And if they have to run with a metronome for a little bit, it's okay. It's okay. It is going to help them in the long run. It may feel silly to them, but really try to encourage them to either set a metronome or to find music playlists that are at a certain cadence if you want them to run at that speed. Okay. So just going off of some interventions that I like to use too, depending on if we're trying to improve that mid stance, their ability to, their trunk lean, their ability to exchange, the feet to propel themselves forward. These are just things that I personally will use to try to improve each portion of running form, right? So we definitely need to look at them in pose, like we talked about, in that running pose and that single leg stance. And then I will go from just a stationary to being able to quickly exchange the feet. So going from the left leg to the right leg and back and being able to just own that position, okay? And dynamically own that position. And then going forward with it. So if you can own it, standing on one leg, own it, exchanging the legs in stationary, then let's try to own it going forward too. Now, it may feel clunky, it may feel weird, but if you speed it up and increase that cadence there after you've done the dynamic pose, having them go through it over and over again going forward, they can turn that into that running and jogging, okay? Working on the fall, we just talked about that a second ago. So their trunk lean, trying to improve that trunk lean by using banded activities or the resisted falling, holding onto their shoulders. And then for pulling, for that exchange off the ground, I like to use the dynamic pose that I just talked about. And then your stepping drills, right? Your high knees. So we'll go through a couple of different levels to that, a couple of different speeds to that. So we may start them out at 180 beats per minute cadence and have them do at a height, have them do like a stepping drills at a height where, if they are doing more of a marathon speed, we might just have them lift their heels or their feet up to about ankle height. They're doing more of like a mile speed, we might have them lift their heels with those stepping back and forth to like mid shin. And then if we're working with a sprinter, we try to get them to where their heels and feet are coming up to about knee level. So working on that cadence, working on that speed in those positions is key. It's beneficial. Okay. Wall drills, I really enjoy using those too. So doing like a single leg exchange, I have a example of that here on the right picture where we're in that triple flexion and triple extension, right? Triple extension of that left leg, triple flexion of the right, and then quickly exchanging the two. So having them do that in a position where they're confident and comfortable up against the wall and making them own that position. And you can see strength deficits here just by having them do this. So if you've gotten to the point where you're getting them to here and you're not sure whether or not, based off of strength testing, they're looking good, they're feeling strong side to side, Get them in this dynamic position, see if they can stay there. So work on that neuromuscular control as well after you've improved that strength. So where do we begin? At the end of the day, when you bring a patient in and you've done your assessment and you've looked at their strength, their motion, their flexibility, you've gone through the rest of your exam and evaluation. Film the run, have them go run. Now, if it's an acute injury and they're swollen and they're having a ton of pain, you may not want to run at this time. You may not want to assess the running. You may want to work on the deficits you saw. Now, once you get to the point where you're ready for them to run, film the run. Film it regular speed, film it in slow-mo, film it from multiple angles, both, forward, backwards, and lateral. That way you can assess everything, looking at every aspect of the run. Okay. Then give yourself time to assess. If you see something that's glaring and you see it and you're like, bam, this is it. I need to work on this. Start to introduce things to help with that. But then when you have time later, go through and assess it more. Okay. And show the patient, go through it with them and say, hey, look, this is what you look like running. Okay. We need to improve this. If you want to stop getting hurt, we need to change this, this, and this. Okay. So go through it with them and show them, get that buy-in. Okay. Start simple, start more global, give them something that they're going to be able to do and do well and be able to do at home without as much guidance. Get that buy-in. You're working through a lot of habits, a lot of ingrained movements, a lot of ingrained thoughts that they have these preconceived notions of how they should be able to run and how they should be running. And you may be working against some coaching and some situations where they're being coached to do something different. They're being told to do something different. Okay. You are the key to their success if you take the time to really work on their form, work on their ability to run with that correct form, work with them on understanding their load capacity, whether it's nutrition, and if we need to refer out for that, we can, their sleep, making them look at every single day like it's a new day, okay? Go through that with them, help teach them, help them learn how to assess themselves daily. And then after assessing that load capacity, help them know and how to figure out, give them the tools to figure out how to assess themselves while they're running. Okay. Because at the end of the day, running's a skill. Okay. So 2 videos here, just looking at just a forward, backwards view and a lateral view of someone running. So in this situation, you can already see there's hip drop, right? So glute med weakness looks bilateral in this situation, a little more on the right than the left at times. That heel whip that we talked about, there's a lot of heel whip there, okay? Both look like lateral heel whip, left and right. So, and from this position here, you can see we're looking at the ground, we're running. Definitely need to work on that, okay? Working on that hip drop, we see that here, that heel whip, important to look at. So here's a perfect example of being able to assess things from that rear view, okay? So here's the lateral view. We can see some other things here. So we slowed it down. Initial contact way out in front of ourselves, getting away from our center of mass. We are heel striking, so not saying that is necessarily a bad thing, but the overstriding with the heel striking is the issue in this case, okay? A lot of vertical displacement too, we're seeing that. So cadence is probably a little slow. So speeding up that cadence probably fix the vertical oscillations and the overstriding in the situation. You can still kind of see the hip drop from the lateral side as well on this situation too. So This is why it's beneficial to look at it in multiple ways, not just one way, not just have them run and film it without trying to slow it down too, because there's key things that you can miss, okay? So there's just showing that right side, like we talked about, there's a little bit more heel drop than the left, the hip drop than the left side, okay? 13 degrees almost on the right side and then 6 degrees on the left in this situation. So there's that initial contact out in front of the body, okay? And there's just an example of that level of fall, his angle of fall. It's about 8 degrees, so it's not terrible, okay? So final thoughts. Like I've been reiterating through the whole PowerPoint, through this whole presentation, running is a skill, okay? And to improve on that skill, you have to work at your craft. Just like any other sport, you can't just go out and be successful at it without working on each aspect of what makes you a good runner or even just a decent runner, okay? So breaking it down and figuring out how to run better, to run more efficiently, to decrease our chances of injury is huge. So work on it just like you would any other sport, okay? One intervention may fix all the issues. Trial and error. Fix the cadence. Maybe the overstriding improves immediately. Vertical oscillation improves immediately. Maybe working on strength deficits and glute med immediately helps with that hip drop, and then other things improve after that. So I'm not saying it's always that easy, but a lot of times when you start working on one big major thing that's we're having issues with, a lot of the other things start to resolve themselves too, okay? We are breaking habits. We're breaking habits that are ingrained, that are there, that have been there since they began running, okay? Whether they intended to or not, when they were little and they started running around, we are breaking habits, okay? So remember that when things get frustrating and things aren't changing as quickly as you would want to, or the patient or the client would want to. So be patient. Creative cues always help. Find things that work, and you may have to try different ones on different patients, and you may have to come up with different ones. Okay. So you may have to try something new that you haven't used, and you come up with something on the fly, and bam, it worked for that patient right there. Try to use it in other situations too. Just like I do with the break the glass. Just came out of nowhere. I used it on one patient. It seemed to work. And every time I've utilized it, it has worked successfully. So I found something that works for me. Find something that works for you. Okay. And these are my references. Thank you.